So HeadStart Hull has been running for quite a while now in Hull. We're part of a 5-year programme. We're in our 5th year. And one of the key elements of what we've been doing is, as alongside having some distinct targeted services aimed at mild to moderate conditions, it was very much about how do we skill up that workforce, and that's not just about clinical workforce, that's about anyone who works for young people. So going back to what Scott was talking about earlier, we know young people have trusted adults. They're not always the people we would prefer them to pick to make our lives easy. So if they all picked a school nurse, that might really help. But sometimes it's a youth worker, sometimes it's someone in family or community. We have a very active fishing club in Hull, where we've trained up some of the facilitators of the fishing club in youth mental health first aid, because that's who some of the young boys and young men talk to. So what I'm going to talk you through is the framework we've put in place and what we've achieved through that, and then we can have a bit of a discussion. Are those slides moving on okay?
Yep.
So, yep, great. So in Hull, we're adopting the Thrive model, which I won't go through in detail because I'm sure many of you are quite familiar with, but it's basically about trying to use some clean language. So a lot of people who work outside of health don't understand tier 1, tier 2, tier 3, tier 4. So it uses the getting advice, getting help, which is early intervention, getting more help, which tends to be more clinical interventions, and getting risk support, which can be things like crisis. And the bit that the workforce development really fits into best is getting advice. And the aim was very much as part of HeadStart, we wanted to improve the skills, knowledge and confidence of frontline workforce, because in our development of HeadStart, we did a lot of not just co-production with young people and parents, but also co-production with a whole range of services who worked with children and young people. And some staff said they didn't have the confidence or the knowledge. And really it was about how do we skill up at the right level a range of workers across a range of agencies. So what we wanted to focus on was improving awareness and understanding of children's mental health, and that also includes things like looking behind the behaviour at what are the factors that are causing that. And that's particularly been focused on schools, but also with VCS and other organisations. It was about improving understanding of risk and protective factors, which can impact on or even improve mental health and well-being, and the benefits of having the support of a trusted adult. And it was about an improved offer for children and young people who were most vulnerable to poor mental health, making it easier for them to access support when and where they needed it. So as we were very clear from the start, this wasn't about turning youth workers into psychologists, but it was about making sure whoever a young person turned to as a trusted adult had the confidence to provide information, advice and guidance and know what services were out there. So we provide our training plan through a range of different methods. Some of these have been more developed over the last year for obvious reasons. So we have face-to-face and virtual facilitated training courses. We have non-facilitated online learning sessions, so they're kind of like self-facilitated. Access to short training films. So we did a batch of these, particularly during the pandemic. Some of them focused on relevant issues to COVID, so things like normalising anxiety, because actually who wouldn't be anxious after the last year and a half? But also picking up on other things. So we did some about gender identity and LGBT to help staff feel confident in understanding some of the challenges those communities may face. We've also done webinars, thematic events, and we have regular networks and forums such as our Schools Resilience Network, which brings schools across the city together to look at issues around mental health. So when we were developing the framework, we wanted it to have meaning, a bit like in the tiers for mental health. Level 1, 2, 3 and 4 often don't mean much either. And sometimes managers would say, well, which training is appropriate for my staff? So we tried to build a framework linked to the NHS prevention and lifestyle behaviour change competencies framework, but using terminologies that staff could easily recognise related to their role. So we have respond, initiate, intervene, and influence. Now, the next few slides, there's quite a lot of writing, so I'm just going to summarise. That's because I've used this somewhere where it was on a huge screen rather than your laptops. But the slides will go out afterwards, and I'm always happy to have discussions after this event if anyone wants more detail. So in terms of respond, this was about identifying workers across the partnership who just needed enough skills, knowledge and experience to be able to respond if a young person asked a question, and identified them as the person they wanted to talk to about their emotional health and well-being. So it wasn't someone with a specific intervention or pastoral role. So the kind of stuff we've had on training at this level is sessional youth workers, we've had caretakers of schools, admin staff, lunchtime supervisors. So those that have contact with young people but wouldn't necessarily be seen as providing mental health support in the traditional sense. However, sometimes we've had teachers come on some of this if they don't have a designated pastoral role, just so they have enough knowledge and information. So examples of this kind of training that would fit under the respond criteria are things like the youth mental health first aid awareness, which is about 2.5 hours. It used to be called light. We have some self-harm awareness, which is a couple of hours training, and identifying talking about suicide. And again, that's a short training course. We also have some self-facilitated training on things like how to have conversations about mental health, supporting the family, talk suicide, which is national training, and introduction to adverse childhood experience, and one through Solihull, which is understanding the teenage brain. So all of these are short, snappy courses that provide some basic information so that the person is able to respond to the young people. And there is a link at the end to the website where we post all these. So when the slides go out, you'll be able to see a bit more detail about each of these courses and also view some of the films. So the next stage was about initiate. So this was workers who would be maybe initiating conversations. So where they'd identified a concern about the young person and wanted to initiate that conversation rather than respond to the young people. So this could be teaching assistants, youth workers, particularly those workers who work with young people in less structured context, but who may see them regularly and spot changes or concerns. So although these staff don't need to have an in-depth understanding of mental health, they usually have pre-existing relationships with those young people. So as I say, could notice the early warning signs. And they can then support young people to access services. So the kind of training we have is youth mental health first aid, which is usually the 1-day course, self-harm awareness. Some of these cross over and can be relevant to 2 different groups. We also have some on understanding sleep and attachment awareness, and some of the self-facilitated training is things like understanding anxiety and trauma. And again, this is just about a different level. Now, staff can move between levels, and really it's for managers to use this framework in their PPDs to decide which staff need which kind of training. But we've tried to make the training of different lengths as well, because we're aware if you're a sessional worker who only works 10 hours a week, you're not likely to be allowed to come on a 2-day course, because then your workplace won't see you for 2 or 3 weeks. So we've tried to keep it relative to the roles. Intervene was really about staff with specific roles in relation to mental health and wellbeing. So this wasn't about clinical staff, but those who could provide low-level interventions to individuals or to small groups. So this was about giving them a better understanding of some of the key issues and some of the skills and knowledge they would need to facilitate those groups. So that includes things like the 2-day youth mental health first aider. We have a more detailed applied suicide intervention skills training course, and we also have one called self-harm response. So it's less about awareness and more about how do we support young people living with self-harm. And then we also have things like attachment awareness. And the final one was influence. We originally called this leadership, but we also co-produced this for young people, and they didn't like that term because they said it made it sound like that was more important, and every role is important in supporting young people. So the influence is usually staff in management roles. So that could be senior leadership team members, schools mental health leads. Bear in mind we've put this in place over the last 4 years before the national training came online. So we're already building some of those building blocks for when that was ready. And also training for school governors. So all school governors or boards of trustees, if they're academies, have a lead safeguarding governor, and what we're doing in Hull is rolling out as part of the whole school approach that we have a lead governor for emotional health and wellbeing as well. And people in these roles usually act as a resource for support for more frontline staff, and can influence policy and practice in organisations. So examples of the training that are facilitated, we've worked with the Carnegie Training Society in Leeds. Some of this training is developed in-house and some of it is bought in. And leading mental health from the middle for those middle managers, development program for mental health schools leads, developing mental health schools policy, and also governance leads. And although the governance leads is aimed at initially was aimed at school trustees or boards of governors, we're also rolling it out to boards of trustees for local VCS as well. So what's been the impact of having this in place? The feedback we have from the training is great, and staff have said that they feel much more confident in understanding the issues, and including understanding what the role of a trusted adult is. It doesn't mean it's their responsibility to do everything, but it does mean they're the person that the child's chosen to confide in. And it's about them being able to support that child within the wider system. We've seen a lot of improved joint working and shared language, which has really improved partnership, joined up approach, because often you have more than one agency working with a child or family. Improved understanding of the children's mental health or the Thrive system in Hull, so what's available at what different levels, and that's actually seen some improvements in appropriateness of referrals to the various different organisations or services. Improved identification of need and appropriateness of referrals, and organisations embedding this training into inductions and PPDs, and school and youth organisations achieving the whole school or organisational approach or working towards this, use this plan very much to look at their workforce development. And it was about having one plan for the city. So the next steps, we're currently undertaking a training audit to identify and target underrepresented teams on the training. So over the last 3 years, which organisations have put staff forward, which perhaps haven't, and how can we have those dialogue with those organisations to see how we continue to develop this framework to meet their needs. Development of future modules to respond to identify needs. So I've mentioned the governor training and the senior mental health leads in schools, but also eating disorders. We know there's been an increase in children and young people needing to access support around eating disorders. And as we did with the self-harm, having a 2-hour self-harm awareness and then a 2-hour supporting a child living with self-harm, we're looking at similar modules for eating disorders. Particularly schools staff have said if a child is living with an eating disorder or with self-harm, even if they're in CAMS 1 hour a week, they're in school hopefully 5 days a week. So this gives non-clinical staff that confidence that they're not giving mixed messages or getting things wrong when they know that's an issue for that child, and they can be part of that circle of support. And we're implementing a citywide approach to trauma-informed practice. So that's a whistle-stop tour of what we've done in Hull, but I guess I wanted to make sure this was more of a workshop, and less of just me talking at you for 30 minutes. When the slides go around, there's a link to our website, which is co-produced to young people, parents and professionals, particularly the training page, but also there's a general professionals page as well in terms of resources, because I think an important part of training is it isn't just about coming on a course, it's also about, are there self-care resources that young people can use and that professionals can share with them? So there's a lot of resources there. So I will stop sharing my screen if I can